Sit-to-stand is a good weight-bearing exercise for people with mild hemiparesis. Since patients can use the bed at the hospital or a bath table, no extra equipment are needed. First, to straighten postural stability, stand up with hands on the bath table. At this time, hand is used only to improve the body balance. It is not used to lift up the body. If the hand is used mainly to stand up, upper limb strengthen rather than the lower limb. This is a wrong example of this method. Now, it shows a correct example of the method. Hand is used to improve the body balance only, but not used to lift the body weight. As the time balance improves, stand up while extending hands up in the air without touching the bath table. Hands in the position prevents and decreases injury. Although sit-to-stand is a good exercise method, people with severe unilateral or extremity weakness stand up with the weight bearing on affected side of the foot, rather than the weak lower limb. For this makes training less effective, it is important to put even more weight on both feet. Abductor muscle at lower limb, such as hip abductor, is important muscle in gait. This scene shows strengthening of the hip abductor. With string placed above the knee joint, patient abduct his or her lower limb maximally and maintain this for 10 seconds. Through this method, the patient can strengthen hip abductor in stable, lying down posture. Muscle which adducts lower limb hip adductor is also important in walking. This scene shows strengthening of hip adductor by pressing the pillow using two knee joints with a pillow between them. Patients should press the pillow for 10 seconds. Balance is essential in walking in everyday life. I will show you the way of balance training at sitting and standing position respectively. This shows training of sitting balance by reaching and moving on rings. Stepping one foot on the ground. Training with a vertical balance trainer helps you to balance yourself in standing position. Now, let's see the clip. Many stroke patients say that it's harder to step down the stairs than to step up. This is due to the difficulties in controlling the flexion of knee joint. Stepping down and touching the ground makes them overcome these kind of difficulties. However, it has to be done in the right process if the training is to be effective. At first, for the safety of patients, training should be done while holding the safety bar. Make sure not to make the beat sound from the rapid touchdown of the foot. To make the training work, step down slowly and make light touch on the ground. Imagine an egg on the ground and try not to break it. When patient's balance is improved, training can be carried out without holding the safety bar. In this case, as well, stepping down slowly makes the training more effective. This scene also shows stepping down, but with a rubber foam this time. Maintaining balance is more difficult on rubber foam because it is soft. Therefore, it makes the training effective. Step down slowly, imagine an egg on the ground to make training more effective. When patient's balance is improved, training can be carried out without holding the safety bar. This scene shows playing a game with the right and left movement, and up and down of a body weight. People with unilateral lower extremity weakness tend to put more weight on normal leg. Even if they shifted their weight on the weak side of leg, they tend not to flex their paralyzed leg. By playing a game with this machine, people train themselves to shift their weight to weak lower limb and to flex lower limb while weight being loaded on weak side. When the weight is shifted to right, the cursor moves right, whereas weight shifted left moves the cursor to left. Flexion of lower limb moves the cursor upward, and extension of lower limb moves the cursor downward. To stretch out the shortened muscle, it is important to maintain the stretched state. I'll show you the method of stretching knee flexor and triceps rib respectively. This scene shows the method for knee flexor muscle stretch. Flex trunk slowly and then maintain the posture for a minute when you feel the pulling of knee flexor muscle. When stretching of triceps rib muscle in standing posture, the muscles are not relaxed fully so that it gives no effect. Since lying down on sliding rehabilitation machine provides the conditions for right angle of foot plate and fully relaxed muscle, your muscle deals with appropriate amount of load. For the people who have very shortened triceps rib muscle, pull down the anterior end of plate downward and make their heel keep in touch with the foot plate in the same position. With triceps rib muscle is lengthened gradually, set the anterior end of foot plate more upward to make the muscle become more stretched.
뇌졸중으로 인해 걷지 못한다고 너무 낙심하지 마십시오. 대부분의 환자분들은 적절한 재활 치료를 통하여 다시 걸을 수 있습니다.